Poverty is personal to me. It's personal because I grew up in a family of 12 children. My mom and dad worked full-time jobs and also ran the family farm to put food on the table. When I was young, we heated our home with a wood-burning stove. We did not have indoor plumbing. And notwithstanding the hard work of my parents, they never had two nickels to rub together. When we talk about poverty, oftentimes we're talking about the working poor. We're talking about families who work hard. They try to do the best they can, but there's always barriers in front of them. I know at RMAP we were trying to address some of those barriers, and I know many of the nonprofits here are trying to address those barriers.
As you can see, we are gathering in the middle of an expansive, busy 90,000 square foot warehouse and distribution center for emergency food. What you don't see are the multiple satellite locations, warehouses that we set up temporarily during COVID to pack hundreds of thousands of additional emergency food boxes. And what you can't see right now is just through that blue door adjacent to us is a 30,000 square foot community kitchen that has produced well over 1 million meals during the pandemic for children. All of this infrastructure is both impressive and in many ways sad, a physical representation of the need, the chronic poverty that exists right here in our region, as well as a lifetime of failed policies. Hunger can be satiated for a moment or for a day, but chronic food insecurity will never be adequately addressed simply through the charitable distribution of food. Foodlink knows this better than anyone. Smart, effective policy change that aims to reduce poverty must happen for us to truly reduce and eradicate food insecurity. We're hopeful this legislation allows us to take a big step in that direction, and we're grateful to everyone who made it possible.
So what does the Child Poverty Reduction Act do? It provides us a tool, the tools needed to really address poverty. First, it's a public commitment to reduce child poverty by 50% in 10 years. That's our goal, all right? Then it puts in place a council that will help us develop policies and strategies to end child poverty, or reduce it by 50% in 10 years. Some of those tools will be to come up with strategies and policies and make those recommendations to the governor and make those recommendations to the legislature, and then it's up to us to try to pass them and then to implement them. But then the council will also analyze the state budget on an annual basis and make an analysis and present that to the legislature and the executive of what steps are in that budget that's going to help us reach our goal of reducing poverty. The council will also address structural racism and look at where is there racial inequity and injustice that is resulting in poverty, and what policy responses can we have to make sure we address that.
And this is just a wonderful, great victory that we're celebrating here today. And it's not a victory for any legislators or any particular organization. It's really a victory for families with children who live in poverty. It's important to note, before the pandemic, 1 out of every 2 children in the city of Rochester lived in poverty. Before the pandemic. Before the pandemic, a black child was 2 times more likely to live in poverty than a white child. Before the pandemic, New York's child poverty rate was higher than 31 other states. 2020 was already well past time to be addressing child poverty. This historic piece of legislation says it does not have to be this way. This is not fate. This is not destiny. Good public policy will lift children and families out of poverty.
I have the unique privilege and honor to sit at the intersection of policy, our practices, and our beliefs about whole child health and child poverty. What I see daily is the outcome of failed policies and inaction. What I see daily is individuals and students and parents who deserve to have every opportunity to excel in life. And this bill provides a context for us to finally align what we know works for children and our families, our beliefs, what our practices, the things that we do daily in our schools, what we do behind the scenes through policy and legislation, that would be our practices, but also the policies themselves. To what extent are policies representing the true nature that will provide a vehicle and a pathway for our students and our families to truly live out this American dream of prosperity. Poverty does not see race solely, it does not see gender, it does not see sexual orientation, it impacts all of us. This is why this policy has had bipartisan support, because we all know that the greatest investment we can have is the investment in our youth.
Simply put, all of us see the impact of child poverty both inside and outside of the hospitals every day. There's no aspect of child health that isn't negatively affected by poverty. Children from low-income families and neighborhoods are more likely to be born at lower birth weights, suffer a greater rate of infant mortality, and experience setbacks in areas like language development, chronic illnesses, environmental exposures, nutrition, and injuries. A growing body of research is also beginning to link effects of child poverty and the development of chronic diseases as we move from childhood into adulthood. The brunt of these effects have fallen disproportionately on our families of color. The pandemic has only exacerbated these disparities, as nearly twice as many lower income families reported delaying or missing out on multiple types of health care. The cost that many of these kids and families have endured in terms of health for decades is unacceptable. We can do better.
We have a plan, we have a strategy, we have a great coalition here, we have the commitment. Let's move on this today. Let's have the governor sign this piece of legislation. Let's start our work. Let's move forward, because our children deserve absolutely nothing less. Thank you very much.